The growing field of laparoscopic surgery, commonly referred to as minimally invasive surgery or MIS, is advancing healthcare for patients by providing doctors new tools to accomplish the same goals as they would with traditional open surgery. Access Health caught up with Dr. Stephen McCarris, who is a nationally known leader in the practice of minimally invasive gynecological surgery.
Our minimally invasive surgery is something we offer almost all our patients, and it's a surgical technique that is less invasive, meaning it requires small incisions, usually about the size of a dime, one through the belly button or umbilicus, where a camera is placed so you can look inside the abdominal pelvic cavity. And then usually on the lower left and lower right side of the abdominal wall, an incision, either a dime size or quarter size, is made where you can pass instruments and what we call trocars to get access into the abdominal cavity. And those instruments are actually held by the gynecological surgeon, and it's an extension of the surgical hands.
Laparoscopic surgery can be used for various procedures in lieu of traditional open surgery, which typically involves longer incisions.
The exciting part of what we're able to offer patients now is not limited to gynecology. In general surgery for gallbladders, appendectomies, adhesions, and bowel work, bariatric surgery has had made unbelievable strides in minimally invasive surgery.
The benefits of minimally invasive surgery are multifaceted compared to open surgery, such as shorter hospital stays, as well as a reduction in costs. And what does this mean for patient outcomes?
Laparoscopic surgery lends itself to less post-surgical complications compared to when you do an open procedure. A large incision means a longer recovery, increased risk of infection or bleeding or scarring. If there's less injury, there's quicker healing. There's shorter hospital stays. There's getting the patient back to her life and her normal routine sooner.
Scars may mean bragging rights for a few men, but for most patients and the almost 600,000 women per year that are having hysterectomies in the United States, small scars mean good news.
I still go to the beach. I'm a beach bum. I love going to the beach with my daughter. I don't wear a bikini, but if I wanted to, I don't want a big scar. There's new technology now that can allow us to have a surgery and not have to have that big scar. It was a nice option to know that the surgery could still be done just as well, just as effective, with very little incisions.
I noticed that my periods were extremely heavy, very irregular, painful, and really interfered with my daily activities and my life and all of the activities that I needed to do at the time. There was absolutely no way I could be down for 6 weeks. With my kids at that time, they were, 4, 9, and 11. Dr. McCarris at that point suggested there was a less invasive technique, a minimally invasive surgery.
Developments in instruments, imaging, and surgical techniques have improved the outcomes and feasibility of laparoscopic surgical procedures. Percutaneous laparoscopy is a new category of minimally invasive surgery that requires smaller instruments than traditional laparoscopy and leaves nearly unnoticeable scars. How are they doing this? We enlisted the help of Dr. James Dana Condrup, a minimally invasive gynecology specialist, to explain.
From the point of view as a surgeon, what we're doing is we're doing the same techniques, we're doing the same type of surgery that's been proven over time. We're just using different instruments to do that surgery. So now we're using instruments that are much smaller. They're versatile, they're very easy to use, but the nice thing about the percutaneous instruments, the Minilap and the Percuvance, they're very versatile. Even in difficult surgeries that are very challenging to the surgeon, they're still applicable in that situation also. The Minilap can be inserted directly through the abdominal wall, right through the skin. When I use the Percuvance system, all I have to do is take a small needle, pass the needle through, and then pass the Percuvance instrument through the abdominal wall.
Companies such as Teleflex are dedicated to improving the patient experience by making MIS even less invasive by combining access and instrumentation, making the incision even smaller.
So for a lot of women, minimally invasive surgery, surgery which you have less invasive techniques, is very important to them because they're very concerned about their scars. When it heals, it looks just like a little mole or a freckle, really, really tiny. So the benefit is to the patient from seeing tiny little incisions or not seeing the incision at all. Also, you have less trauma to the abdominal wall when you use these very small percutaneous incisions and very small percutaneous instruments.
When surgery is needed, women need to be educated about what are the associated complications to their particular surgery. That information is available. We encourage women to get involved and be part of the strategy and what they want out of these types of operations, and to actually vet their surgeon that's going to do the best job. That's really what the message is. Find the surgeon that you know is an experienced expert surgeon in the technique that you need.
The tools and techniques for minimally invasive surgery are constantly evolving, and one priority is always in the forefront: what's best for the patient. I'd like to thank our patients and doctors for all of the information on minimally invasive surgery. For more information on the Percuvance, Percutaneous Surgical System, visit teleflex.com. And of course, you can find all of these resources by logging on to our website at accesshealth.tv. Don't forget to follow us on Facebook and Twitter.